My name is Kim Stewart, and I'm here to do an exam on you, Miss Jones. Miss Jones, before I get your consent for this exam, I've just got a few questions. Do you know where we are right now?
Yes.
Okay. Do you know what year it is?
Yes, 2016.
That's right. And can you state your name?
Amy Jones.
Very good, Miss Jones. Okay, thank you. Miss Jones, do I have your permission to do this exam today?
Yes, ma'am.
Okay, I'm going to go wash my hands, and then we'll start the exam. Okay, I'm going to start with your head and inspect it for symmetry. And have you noticed that you had any moles or any abnormal growths on your face or neck?
No.
Okay, do you usually examine yourself annually for any new
Yes.
moles or anything like that? Do you use sunscreen?
Yes.
Good, good, good. All right, so I have checked your head for symmetry. I don't see, your hair looks nice and even all over. All right, now I'm gonna look at your face. Have you had any problems that you know of going on?
No.
All right, can I get you to smile for me? Okay, can I get you to blow your cheeks? Okay, can I get you to raise your eyebrows? Very good. All right, now I'm gonna touch you on top of your sinuses. Ethmoid bone. Okay, any tenderness there?
No.
All right, now I'm going to check your trigeminal nerve, and I'm going to touch your face with a cotton ball, and I need you to let me know where I've touched it. So if I can get you to close your eyes.
Forehead.
Okay, keep your eyes closed, please.
Cheek.
Which cheek?
Left. Right. Nose. Chin.
Very good, thank you. Have you had any trouble with grinding your teeth?
No.
Any pain in your jaw area?
No.
I'm going to palpate your temporomandibular joint, so I'm going to get you to open and close your mouth. Close, open, close. Any pain or discomfort there?
No.
Okay, good. All right, now I'm going to look at your eyes. Do you wear glasses?
No.
Okay, have you noticed any drainage or any blurred vision, double vision, seeing spots, anything like that with your eyes?
No.
Okay, I'm going to pull your eyes down. I'm going to look at your conjunctiva, and I'm looking for redness, drainage. Looks good, it's pink and moist. You normally go have regular eye exams?
Yes.
And you see an ophthalmologist for those?
Mm-hmm.
Okay, good. We're going to do a visual acuity test. So I'm going to get you to hold this over one of your eyes. And I'm going to get you to read what's written here on this piece of paper. Okay. All right, cover your eye. Can you read that for me, please?
ADOPG.
Okay, can you cover the other eye?
ADOPG.
Very good. Thank you. Okay, I'm going to check your trochlear, your oculomotor, and abducens. So I'm going to have you look straight ahead, and I'm going to shine a light in your eyes, and I'm going to be looking for a reflection of light in your pupils. All right, very good. Now I want to get you to follow my finger with your eyes. Very good. And normally I would check your corneal reflexes with a piece of cotton to see if you blink or react when I touch, but we're not going to do this for the video today. All right, we're going to move on to your ears. Have you had any hearing loss, any drainage from your ears?
No.
Okay, good. I'm going to look at your ears. I'm going to touch them. You tell me if there's any pain or tenderness.
No.
Okay. I'm going to look at your ears. Okay, I'm looking at your eardrum, your membrane, tympanic membrane, and it is reflecting light, and it is a pearly gray color. I'm going to do the other side. And I see the tympanic membrane, and it is also pearly gray and reflecting light. Okay, now we're going to check your acoustic nerve. I'm going to stand behind you, and I'm going to repeat several numbers, and I want you to repeat those back to me. 135.
135.
246.
246.
Okay, we'll go to the other side. And please repeat. 135.
135,
246.
246.
Very good. Now usually that is the Rena test, and usually we would also do a Weber test, and that requires you using a tuning fork, which I don't have with me today, and it will measure and see about your air and bone conduction related to your hearing. Next we're going to check your nose. Have you noticed any changes in your smelling? Had any drainage, any bleeding, anything of that nature?
No.
Okay, I'm just going to touch your nose. Okay, it's straight in midline. Any tenderness when I do that?
No.
Okay, I'm going to have you take your finger and include one of your nostrils and take a deep breath. Okay, and I'll have you repeat that on the other side. Okay, do you notice any difference in the amount of air that's flowing, any
No.
decreased air, occlusions, anything like that? Okay, now I would like for you to close your eyes, and I'm going to place something underneath your nose, and I want you to tell me what this smells like, if you would.
Alcohol.
Alcohol, that's right, alcohol prep fat. All right, now I'm going to get our light, and I'm going to inspect the inside of your nose, okay? And I'm looking to make sure there's no lumps, bumps, lesions, sores, and make sure that your septum is midline, which it is. We're going to talk about your mouth. Have you had any sores, sore throat, anything going on with your mouth?
No.
Okay, how about cough?
No.
Okay, can I have you cough for me, please? Okay. I'm going to take this tongue depressor and I'm going to place it in your mouth, and I want you to say, ah. This is checking for your glossopharyngeal and your vagus nerve. Say ah. Okay, and while I'm in here, I'm going to look for any redness, lumps, bumps, tonsils, exudate, any of those things. Okay, it all looks good. Thank you. Okay, have you noticed any change in your taste?
No.
Okay, and normally when I have the tongue depressor in, I would touch the back, more towards the back of your throat and activate your gag reflex, but I'm not going to do that today. Just so it's done a lot of times. All right, I want you to take your tongue and stick it to your chin. Okay, and then stick it to the inside of your mouth. Okay, very good. Now, when I was looking in your throat, I noticed that there's no redness, no drainage. Your uvula was midline, and it did move when you said ah. And your tonsils were still there, so it all looked really good. Okay, now I'm going to check your neck. Have you noticed any dryness in your hair or your skin?
No.
Or any brittleness in your nails or your hair?
No.
Okay, I'm just going to look at your trachea, and it seems midline. Very good. I'm going to palpate your lymph nodes. I'm going to start with the periocular, postocular, occipital, tonsillar, submandibular, and submental. All right. Did you have any pain or tenderness?
No.
Okay. Well, I didn't feel any lumps or enlargements of your lymph nodes. All right. Now I'm going to check your trachea. I'm going to have you take a deep breath, and I want you to swallow. Okay, that's good. Now I want you to lift your shoulders up, shrug your shoulders up. Okay. I'm going to try to push them down. Please don't let me. Okay, now you can relax. Now I'm just going to check for CBA tenderness in your over your kidneys. Okay, do you have any tenderness there?
No.
Okay, good. All right, now I'm going to examine your thorax. Have you had any trouble breathing?
No.
In the past? Do you have a cough? Have you had a cough recently?
No.
All right, how about any history of pneumonia?
No.
Or tuberculosis?
No.
Okay, good. All right, I'm going to look at you from the side. I'm just looking for a barrel chest or protruding, if you look straight ahead for me, protruding eyes, which is good. Okay, now I'm going to palpate you for crepitus, which is subcutaneous air. Okay, and I'm going to have you say 99. I'm checking for tactile fremitus.
99.
And again.
99.
And again.
99.
Okay. From the front. All right.
99. 99. 99.
Okay. Now I'm going to have you take, I'm going to put my hands on you. I'm going to have you take a big deep breath. I'm just looking for movements of my hands. Okay, very good. Now I'm going to listen to your lungs. Okay, big breath. Okay. Lungs sound really good, thank you. During your exam, I've been watching your breathing, and I've noticed that it's been regular and unlabored. You've taken nice deep breaths with no difficulty. I'd like to examine your heart. Have you had any chest pains?
No.
Okay, good deal. I'm going to check your nail beds and just looking for your circulation, make sure they're pink. Your capillary refill is less than 3 seconds, which is good. Your extremities are warm. I'll check your feet. All right, we'll see if there's got any edema, which I don't see any. All right, I'm going to check your pulses, check your carotid. Okay, I'm going to check your brachial, check your radial, popliteal, tibial, and your pedal. Now we'll do that on your right as well as your left side. Have you noticed any numbness or tingling in your hands or feet?
No.
Okay, good. I'm going to listen to your carotid arteries for any bruise, and I'm going to listen to your heart. I'm going to ask you to hold your breath. All right, good. Take a breath. All right, hold your breath, please. All right, thank you. I'm going to listen to your heart. I'm going to listen to your aortic, pulmonic, tricuspid, and mitral. Now normally when I listen to your heart I would do it for a full minute, but for this video we're not going to. And then I'd also be assessing your jugular veins for any distension, which I don't see any. I'm also going to check your Hoban sign for any deep vein thrombosis. And what I'm going to do is, I need to remove your shoe. I'm going to flex your foot. Did you notice any pain in your calf? Okay, if you had pain in your calf, it would be indicative of possible DVT. Okay. Ms. Jones, I'm going to check your abdomen now. Have you had any nausea, vomiting?
No.
Diarrhea?
No.
Constipation?
No.
Have you noticed any changes in your eating pattern?
No.
Any more, eating less, any weight loss, weight gain?
No.
Okay. All right, good. I'm just going to look at your abdomen. Okay. Have you had any history of any hernias, umbilical, inguinal?
No.
Okay, good. All right, I'm going to listen. I'm listening for vowel sounds. Okay, vowel sounds are present, all 4 quadrants. Now I'm just going to palpate. I'm just checking for any tenderness, any masses, for the bladder. All right, now I'm just going to percuss, which I'm going to listen to different sounds that may be emanated. All right, thank you so much. All right, I'm going to check your musculoskeletal system, have you noticed any changes in your gait?
No.
Have you noticed any tremors?
No.
Okay, I'm gonna have you walk back and forth just slowly. Okay, come back this way. Okay, I was just making sure that your gait was steady. There wasn't any shuffling. Now I'm gonna have you bend over and touch your toes. I'm just gonna check your spine for any curvature. All right, good. Now if you'll stand back up for me and check your range of motion. I wanna get you to hold your arms out. Bring your arms in to you. Okay, behind your head, behind your back. And that was checking abduction, adduction, external rotation, and internal rotation. I want you to do, while you're standing up, I want you to close your eyes, hold your arms out to your side. I want you to bring your finger to your nose. Do the other side. Do it one more time on each side. Very good. Now I'm going to have you sit on the stool. And I'm going to check Babitsky's reflex. And what this is checking is when I rub the bottom of your foot, your toes are going to point down. Okay, that's good. Now this concludes our exam. Do you have any questions? Do you feel like I might have missed anything?
No.
Okay, well thank you so much for your time, Ms. Jones.
Thank you.